Neurology quiz number 43. What are the SANAD and SANAD 2 trials and what are their results? The SANAD Standard and New Anti-Epileptic Drugs Study was an unblinded, randomized, controlled trial conducted in hospital-based outpatient clinics in the United Kingdom that compared the cost-effectiveness of standard and new anti-seizure medications available as monotherapy options. The SANAD trial Arm A recruited 1,721 patients for whom carbamazepine was considered by treating physicians to be standard treatment, i.e. patients with focal epilepsy. Patients were then randomly assigned to receive carbamazepine, oxcarbazepine, lamotrigine, topiramate, and gabapentin. Primary outcomes were time to treatment failure, time to 12-month remission, and assessment was by both intention to treat and per protocol. Lamotrigine performed significantly better than carbamazepine, topiramate, and gabapentin for time to treatment failure, with a non-significant trend compared with oxcarbazepine. For time to 12-month remission, carbamazepine performed significantly better than gabapentin, with a non-significant trend compared to oxcarbazepine, lamotrigine, and topiramate. Based on the trial, lamotrigine proved better than carbamazepine for time to treatment failure outcomes and as a cost-effective medication for initial monotherapy of focal epilepsy. Arm B of the study recruited 716 patients for whom valproate was considered to be the standard treatment. Patients were randomly assigned to valproate, lamotrigine, or topiramate. Primary outcomes were time to treatment failure and time to 1-year remission, and analysis was by both intention to treat and per protocol. For time to treatment failure, valproate was significantly better than topiramate, but there was no significant difference between valproate and lamotrigine. For patients with an idiopathic generalized epilepsy, valproate was significantly better than both lamotrigine and topiramate. For time to 12-month remission, valproate was significantly better than lamotrigine overall, and for the subgroup with an idiopathic generalized epilepsy. There was no significant difference between valproate and topiramate in either the analysis overall or for the subgroup with an idiopathic generalized epilepsy. The study concluded that valproate is better tolerated than topiramate and more efficacious than lamotrigine, and it should remain the drug of first choice for many patients with generalized and unclassified epilepsies. However, because of the known potential adverse effects of valproate during pregnancy, the benefits of seizure control in women of childbearing age should be weighed against the teratogenic effects. The SANAD 2 was an open-label randomized controlled trial to compare levetiracetam with valproate as first-line treatment for patients with generalized or unclassified epilepsy. Adult and pediatric neurology services across the United Kingdom recruited patients aged 5 years or older with 2 or more unprovoked generalized or unclassifiable seizures. Patients were randomly allocated to receive either levetiracetam or valproate. The trial was designed to assess the non-inferiority of levetiracetam compared with valproate for the primary outcome, time to 12-month remission. Analysis of the trial results showed that 12-month remission was superior with valproate than with levetiracetam. Levetiracetam did not meet the criteria for non-inferiority. The study concluded that compared with valproate, levetiracetam was found to be neither clinically effective nor cost-effective. Because of the teratogenic side effects of valproate in women of childbearing age, prescribers should consider the benefit to risk ratio of each treatment. Another SANAD 2 study was a randomized open-label control trial comparing levetiracetam and zonisamide with lamotrigine as first-line treatment for patients with newly diagnosed focal epilepsy. Adult and pediatric neurology services across the United Kingdom recruited patients 5 years or older with 2 or more unprovoked focal seizures. The trial was designed to assess non-inferiority of both levetiracetam and zonisamide to lamotrigine for the primary outcome of time to 12-month remission. Levetiracetam did not meet the criteria for non-inferiority non-inferiority, whereas zonisamide did meet the criteria for non-inferiority versus lamotrigine in the intention to treat analysis. The per-protocol analysis showed that 12-month remission was superior with lamotrigine than with both levetiracetam and zonisamide. The study concluded that these findings do not support the use of levetiracetam or zonisamide as first-line treatment for patients with focal epilepsy. Lamotrigine should remain a first-line treatment for patients with focal epilepsy.